This past spring, when I decided to apply for the Hutchinson Regional Academy summer internship, I had no idea what I was getting into. My perception of the medical field was this: that you have doctors and you have nurses, and that the nurses do all the work. At least that's what my grandmother told me. She's a retired nurse. But I really had no idea what went on behind the walls of the hospital. Hi, I'm Anthony Clennon, and today I'm going to be sharing with you a little bit about my summer in the Hutchinson Regional Academy, what I learned from it, and how it has affected me and my future. So first, I would like to talk about some of the most memorable experiences I had in a few of the different departments. Of course, I would love to talk about all the departments that I went to, but there's not enough time for that. So first, I'm going to be talking about my experience in wound care. Wound care is really cool because you can really form relationships with the patients because you get to see them like every week for several weeks on end. There's also some really satisfying recoveries that you get to observe and you get to witness. You have patients who come in with like gaping holes in their shins or some other crazy wound, and then like in a period of a few months, you'll get to see that slowly get better and eventually just turn into this little tiny scar. And then lastly, of course, there's some pretty gnarly wounds that you get to see. And while some people don't have the stomach for that, I think it's pretty cool. So what did I learn from wound care? I learned, obviously, kind of, how to treat wounds the correct way. They told me that you want to use a saline solution instead of just regular water when you're treating a wound, and that you want to keep the wound the right moisture. You don't want it too moist or too dry. And then lastly, this is probably the most important, just kind of leave it be. If you're messing with it, it's just gonna make it worse. And then lastly, I learned patience because wounds, they don't heal overnight. So you really need patience in wound care. The next department I would like to talk about is pathology and lab. This department is so diverse. That's one of the reasons I like it. You have microbiology, chemistry, hematology, pathology, phlebotomy, and blood bank. These are the ones that I got to observe. And it's cool because the people in those departments, they kind of do their one thing, like the microbiologists kind of do their microbiology, but they're able to do everything in the department. They can do the chemistry, and sometimes they get to. So it's just, there's a lot of diversity in this field. I also really like how it's so science-based. You have, it's kind of like the fun part of science class is kind of how they describe it to me. You get to look through microscopes all day and like run tests and spread specimens on petri dishes. It's just all pretty fun. And lastly, they're kind of like medical detectives there. They're taking data from their tests and their lab work, and they're piecing it together to try to solve the mystery of the patient's symptoms and like what's causing them. So what did I learn from pathology and lab? I kind of learned what happens behind the scenes at the hospital. The lab is kind of this department that you don't really ever see, and you probably, some people don't even really know about, but they're super important, and they really make the diagnoses possible for the doctors. And that kind of leads into the next thing that I learned, how interdependent the hospital is. So everyone in the hospital kind of relies on each other. The doctors, they rely on the lab to get them their results. Without everyone in the hospital just couldn't run as efficiently. So after I took that last slide out, but so after the internship, I kind of just sat down and I thought about the internship as a whole and kind of like what I could take away from it, and almost more like what I learned from the entire summer. And I came up with these three big things. You have teamwork, communication, and quality. So teamwork is huge in the hospital because everyone, or at least a lot of the doctors, they specialize in one kind of area, and they're really good at that one thing. But then they rely on all the other doctors and all the other nurses and the technicians. They need everyone else with their specializations to help them do their job efficiently. Then you also have communication, and communication is super important, really in any work field, but especially in the hospital, because you need to have communication not only between your coworkers, but also with your patients. I observed this when I was in Chalmers Cancer Center. The doctor there, he was really good at communicating with his patients, what their diagnosis was and what all the different procedures and options that they had. And you could really see how the patients appreciated this and how it really helped them out. And then lastly, quality. This is really just a must in healthcare. And you can see this through their many different precautions that they have to ensure this quality. You have a couple examples of this are the Pyxis thumb scanner. They have this scanner that they have to use in order to be able to draw medicine out of the Pyxis machine. Then they have so much personal protective equipment and different sanitization requirements. Just to make a saline bag, you have to wash your hands, then put gloves on, and then wash your hands with the gloves on, put a gown on, put a hairnet on, and then go into this sterilized room. It's just insane. And then lastly, if they just double and triple and quadruple check everything with their patients. When I was in surgery, I think each patient was probably asked what their name was and their birthday and what procedure they were getting. They were probably asked that each 5 times. It was insane. So after this summer, I'm going to be honest. I'm still not completely sure which career I would like to pursue, but I do know this. I know which fields I don't think I would enjoy, just because of how high stress they are. I also have an idea as to which I might want to go into, that being lab, radiation oncology, which is kind of like Chalmers. I really liked about that one specifically. I liked the machinery in there. It was just so cool how it all worked and how much physics and engineering went into it. And then also therapy, both speech therapy and physical therapy, I think would be pretty cool. And then also, and last, this is probably most important, and probably the biggest thing I've gotten from this internship is I now know what my options are in the medical field, and I really know what each one entails. So overall, I had countless unforgettable experiences. I learned what it takes to work in the medical field, and I discovered which areas of medicine interest me the most. I want to finish my presentation by thanking everyone involved in making this internship possible. It was truly an unforgettable experience, and I can say without a doubt that my decision this past spring to apply for the internship was one that I will never regret. Thank you.